Maambukizi ya COVID-19 kutoka maafisa wa serikali.
Emergency Response Committee on Coronavirus, an update of coronavirus in the country and response measures as at 14th April 2020. Dear Kenyans, today we are beginning a crucial phase in our battle against COVID-19 pandemic. In the last 1 month, we have bared our fight in this, but the numbers have kept rising. We have appraised you constantly on our figures and advised you that it would be much wiser to prepare for the worst. Despite the measures we have put in place, we are already witnessing a phenomenon where the virus is increasingly moving to counties. I think in the last few days you've seen the numbers in the different counties are on the rise. The virus is now domiciled across the length and breadth of our republic, from down south in Kilifi to Mandera in the north, from the west in Vihiga to Kitui in the east. Fellow Kenyans, we have been able to disaggregate the number of cases by county, and this is information I will be sharing with you. And just as an example, we have about 101 cases in Nairobi, 34 in Mombasa, 10 in Kilifi, 6 in Mandera, 7 in Kiambu, 5 in Nakuru, 1 in Kisii, 2 in Kitui, 2 in Laikipia, 2 in Kajiado, 2 in Murang'a, 1 in Homa Bay, 2 in Kakamega, 1 in Nyamira, 2 in Nyandarua, 1 in Nyeri, 2 in Siaya, 2 in Uasin Gishu, 1 in Vihiga, 1 in Kwale. And fellow Kenyans, for further elaboration, it's important to note, once we pick these cases, it's one of two scenarios. We have situations where these cases are tested in the counties, and we have situations where some of these members who are tested are residents of different counties. The reason why we're extrapolating for you the cases by county is to be able to demonstrate to you Kenyans that some of our positive cases are actually Kenyans who've had interaction with different members of the public across the country. Therefore, fellow Kenyans, what this means is that we must work even more closely with our county government to tighten our control measures, to harmonize our responses, and mobilize our people to take an active role in this fight. In this regard, we are rolling out mass testing exercise, taking into consideration the risk profiles of clusters. And as an example, fellow Kenyans, in Nairobi, for instance, we shall prioritize the quarantine centers, hotels, isolation facilities, and hospitals. These form our top 4 priority in Nairobi. We have also identified different cluster areas, and in the coming week, we shall be able to share with you where these cluster areas are within Nairobi County and in the different counties. As an example, Kibera has been identified, and we shall also have prioritized testing in that cluster. In Mombasa, we are deploying 1,000 testing kits to Kenya Ports Authority, KPA. And this is based on the risk of transmission that has been identified from our monitoring teams. And the same will happen in Mandera and Siaya counties. In total, the first phase of mass testing will see approximately 12,000 testing kits deployed to target areas in the next few days. Fellow Kenyans, cognizant of the measures we have taken in the fight of this disease, we are now witnessing a spike in domestic violence, gender-based violence, and sexual offenses. Fellow Kenyans, I have witnessed within the area that I live in, within this Easter weekend, I actually had neighbors coming to my house to report a case of domestic violence. There's a lady who was severely beaten, and really as a Ministry of Health, what we are saying is now is not the time to engage in disputes and to bend about in terms of conferring domestic violence to our partners. We are also in constant communication with the Gender Violence Recovery Center, that's the GVRC, as well as the National Council on Administration of Justice. And both these two organizations have told us that there is an increase both in the numbers of gender-based violence and also sexual violence. And most of the times, it's been noticed that this violence is perpetrated by close relatives and guardians. And therefore, fellow Kenyans, even as we address this between the various government departments, we are calling on Kenyans to focus on fighting the virus and to handle the disputes within the laid down civil structures and devoid of any violence. And we also want to remind everyone that the law has not been suspended and that it will catch up with those who commit violence on others during this period. Fellow Kenyans, we know that we have been asking you to maintain social distance in your interactions. However, it's important for us as a Ministry of Health to articulate that this does not mean you forget the social fabric that binds us together as Kenyans. We do request you to continue communicating with each other, to continue offering each other mental support during this time that we are at war with this virus. With the aid of technology and our social lives should indeed continue and in fact even blossom during this period. Let us keep engaging each other through the available platforms. Let us counsel each other. Be your brother's keeper, fellow Kenyans. Learn and kindly, help us in this fight by standing together with your families, with your communities, with your partners, with your loved ones, and even with your neighbors. To those who are abusing measures that we have put in place, for example, we had reports during the Easter season of house parties in different parts of the country. We shall catch up with you, and we shall be able to meet the law and ensure that you are punished for going against the different interventions and instructions that we have issued. In the last 24 hours, fellow Kenyans, we have tested 694 samples. Out of these samples, 8 have tested positive for coronavirus disease, bringing the total number of confirmed cases in the country to 216. 5 are Kenyans, and the other 3 are of different nationalities, foreign nationalities. 6 have a history of travel from Dubai, the UK, Pakistan, Zambia, and Comoros. The spread of the new cases with regards to their counties of residence is as follows. Nairobi, 6, Siaya, 1, Nakuru, 1. And in terms of age distribution, the pattern continues, and we're seeing that this disease, fellow Kenyans, is actually affecting the productive members of our society. As it stands today, we have about 5 patients who fall within the age group of 0 to 14. We have 15 to 19 falling to 58 in terms of count. And we have about 64% of our cases falling between the age group of 30 to 59, again affecting the productive members of this society. Now, 6 of the cases that we are announcing today have emanated from our mandatory quarantine centers, while 2 were picked by our surveillance teams. Over this same period, Kenyans, 1 more person has been discharged from hospital, bringing the total number of recoveries to 41. A total of 2,331 contacts have been monitored, out of which 1,729 have been discharged. 602 contacts are now being followed up at the moment. I thank you.
Pertains to maybe the person living with a disability, that those are not the deaf people. How are they supposed to embrace the face masks? Because I can even see your sign interpreter doesn't have the face masks.
Okay, I'm Vera Okeo from Nation Media Group. I would like to ask, yesterday I asked about contact tracing. I know it's going to be a very critical part of this. I would like to know whether you have enough people, and if there are enough, what's their specialty? Are they nurses? Are they public health officers? And if they are not enough, what are you going to do to try to increase them? Thank you.
My name is Purity from KBC. My first question is on the gender-based violence. Probably, do we have, what are the numbers, like the statistics of people, and of course you can tell us in terms of gender, who have been most affected, male or female, the age bracket, then we will appreciate, especially on the numbers. Number two, we already have 41 recoveries, but when we have a look at what is happening in other nations, we've seen cases, especially in Japan and other countries, of people who've recovered, but they have been reinfected by this virus. Probably do we have a follow-up program for people who are being discharged from hospitals?
Okay, I'm Daniel Mule from NTV, and still on the same issue about contact tracing. We have seen there are some young people who are coming up with innovations and applications which can help in contact tracing. Are there plans maybe to work with them in that front?
Great. Thank you for all these questions. Let me begin by the question concerning officials who went to EPZ. Indeed, I can confirm that is correct. We have a very agile and diligent team within the ministry. It was led by the DG. And today they were able to go and talk to our different partners at the EPZ. They were there on a mission of inspecting the different materials, the different PPEs, and ensuring that they will be of the right standards and qualities so they're able to protect our healthcare workers. This is an ongoing process, and like we earlier announced and informed Kenyans, we are taking all measures to ensure critical scrutiny is undertaken for all the PPEs that will be manufactured within the country and that will be availed for our healthcare workers. Concerning the question of deaf people and their use of the mask, indeed, the Ministry of Health has rolled out a mass masking policy, and this is a question that we've integrated severally. I think WHO has also released guidelines that actually advocate for mass masking. However, what we are saying, if you're a member who may not be able to utilize a mask, then it is important, therefore, that you pay 100% effort and energy into all the other non-pharmaceutical interventions against COVID. And this includes the social distancing, this includes hand washing. It is important, Kenyans, that you remember, despite you using a mask, remember your eyes are still not covered. And your eyes have a mucous membrane, meaning you can still get coronavirus. And so the mask is just one but of the many measures that will actually help us. With regard to contact tracing, Vera, indeed, if you've seen and learned from different country experiences, especially some of the notable ones being South Korea, contact tracing is extremely crucial in the fight of coronavirus. And there are different ways in which this is being conducted. In Kenya, we have a heavy able team working in the Emergency Operations Center. We've been able to deploy what we call our field epidemiology registrars. These are field-type residents who have been undergoing a master's training for 2 years, and we have them supporting the contact tracing mechanisms. And we've taken this further and employed different IT technologies. We have applications, and perhaps in the coming week we'll be able to share that with you Kenyans in terms of how we are utilizing IT to be able to do, indeed, a lot of rigorous contact tracing. It is important also to remind Kenyans, despite all these interventions, despite using IT, despite having a team of masters, pupils sitting and helping us with this, you Kenyans are the ones who will actually help us in contact tracing. Being aware of your movements, observing the measures that we've put in place, you actually become perhaps the biggest aid in contact tracing for us. With regards to gender-based violence, this is an issue that we're actually looking at. Like I said, it was brought to our attention within the past week that we've had an increase in cases. We'll be able to share with you more disaggregated data, but off the cuff, the numbers we have right now, at least from the National Justice Council, is that we have 3 times more cases. They will be sharing with us a disaggregation based on age, based on sex, and we'll be able to inform you Kenyans once we get that data. However, the underlying factor here should be that we can only defeat coronavirus if we band together, if we are our brother's keeper. Remember, if you're meting out violence on different members and these people end up in hospitals, it means that these people may not be able to observe some of the measures that we've put in place. Therefore, it means that these people then become perhaps even agents of this coronavirus. So you need to protect each other, band together. Again, I think the last question again was on contact tracing. Indeed, we've been approached by various members of the public. We have different organizations such as Microsoft. We have different groups, different developmental partners such as the WHO, ARMREF, Palladium, USAID, all who have come together with us and who have helped us in designing our application for contact tracing. And like I said, we'll be able to share this with you in the next few days. And I must say it's definitely a technology and a tool that we are utilizing for contact tracing. Regarding the recoveries, indeed, purity. We've seen in different countries that members who are getting afflicted are actually still susceptible to recontracting this virus. There's a team that is doing follow-up. Remember, we still have our 719 number that is active and can be utilized. And remember also, for all our cases, those that we come into contact with, be it through contact tracing, be it through confirmatory testing, we actually have a very robust database that is able to get these members up to where they live within the public. We've activated our different structures. We've activated the Ngao structure, and we're using all these structures to be able to have proper follow-up for all our patients. Asanteni. Thank you.